bad because I didn't mention this in pediatrics. You gotta get used to changing some nasty diapers. And yes, you have to change some diapers sometimes. Because I guarantee that kid comes in with a poopy diaper, you don't want that on your x-ray cassette, and you might be the only one there to change that diaper. I'm just saying. It's not that bad. Changing a baby's diaper is not that bad.
No, I'm saying like you're not to change like random people's baby's diaper.
I'm not gonna leave a nasty diaper on that poor kid. That's wrong. You wouldn't want someone to do that to your kid.
It sounds like, I don't know, it's like.
Some of these, or I'll put it this way, Ray, and some of these children don't have parents. They don't have people to take care of them. So if that's a little love I can show that poor kid, I'm gonna do it, you know, take care of them.
They have diapers and stuff just randomly wherever you can change them?
That's a pediatric hospital, there's diapers everywhere. Man, you got Pampers on every corner of that place, let me tell you. Pampers and Huggies,
Really?
man. I'm a Huggies guy, by the way. Huggies all the way. Sorry my Pampers people, but Huggies, that's where it's at.
I'm blessed to not know the difference. Yeah.
Yeah, everyone has their, some people like Love, some like Pampers, some like Huggies. I think Huggies is the best personally. At least with my kids, that Huggies absorbed the best. I didn't have as many of blowouts with Huggies.
Well, Andrew blows out and it's not hugged the right places.
But, you know, back to the point, don't let that poor kid be walking around with a squishy, nasty diaper if everyone else is neglecting the kid. Do a favor for the kid. They might need that little act of service in their life. They may not be getting it at home. A lot of them are not. Okay, we're gonna talk about all the different age groups now, which we got a lot of classifications to go through. We have the premature babies, the neonates, the infants, the toddlers, the preschoolers, the school age, and adolescents. Because keep in mind, technically I should probably say till 17 years, they are considered pediatric all the way up into the age of 17. So they are considered a child, a pediatric child, until they are 18 years old.
So our comps can be adjusted?
You know, I argue they should be, but the ART wants to be crooked with that, so. Because technically, per hospital facilities and healthcare facilities, you are a child until 18 years old. Despite what your 17-year-old might think they are right now, they're still a child till 18. My 10-year-old thinks she's an adult, she's only 10.
So
Yeah.
toddler is not 1 year, it's 18 months?
18 months to 3 years. Yes.
Over one.
Because, and you know what it is, Monty, because of developmental speeds. There's some 18-month-old children that are very advanced. There are some 2-year-olds that are very delayed. They give that range to allow them to grow. Yeah. Okay, so, yes.
So, like, is it, you know, like some of the kids, like you say, age fast? That's why sometimes they do the bone, like a bone survey to check their bones and.
If they're physically aging fast, yes.
Okay.
I was talking more from a cognitive standpoint.
Oh, okay.
Yeah. Yes, to your point, yes, they would do those bone studies. Some kids do rapidly age, and that can actually be a detriment to their development. If it develops too fast, they won't have the full growth potential. At least things like sometimes like dwarfism and other deformities and things like that. Yeah. Okay, so for premature infants, the majority of what you'll do with preemies is going to be relegated to bedside radiography. Why is that? Well, not because they can't stand. I mean, obviously they can't stand.
Could be dangerous.
Yeah.
They are high risk, very high risk. A preemie is a lot of times in an incubator. A lot of times they're on a breathing apparatus because they're so severely premature they cannot even breathe on their own. These are the babies that will code if you so much as make a loud noise. They'll be startled by loud noise and just go into complete code, cardiac arrest. Very sensitive, very high risk patients. So obviously, unless it's some kind of emergency procedure, they're gonna relegate the majority of these things to bedside mobile exams. The only things they will travel with are for GI procedures because a lot of preemies have GI problems. A lot of them have kidney problems, bladder problems. But that takes an entire village to get that baby to the x-ray department. If you've never seen that, when I say it's a village, you got like 10 people coming down with that baby, keeping everything monitored and in check. They got the whole apparatus coming down with them as well. It's a production. It's a whole production to get them in there. In those cases, let them take care of handling that child, because these babies are very tiny, they're very fragile, they're very sensitive. If you don't know what you're doing with a preemie, ask somebody to help you. There's scientific proof that even a premature infant can develop severe mental anxiety and trauma as they age from things that happen even if we say they're not aware of it, they're still aware of it even as a preemie. Things like loud noises, being startled, someone being too rough with them. That has been proven to cause developmental issues with children and even into adulthood. So be very careful. Elevate the room temperature. If you know a preemie's coming to your x-ray room, so our x-ray rooms are very cold, yes? Please turn the temperature up. Once again, these babies, they will code 1 degree difference in the temperature, they'll start coding. Very sensitive. Make sure that room is nice and warm. They'll be accompanied by a nursing team, a lot of people. Like I said, about 10 people come down with that patient. Make sure you explain to the nursing team what you need them to do. I need you to put baby boy C, baby boy A, whatever their name is, on the table. I need you to secure them. I need you to hold the arms out of the way. I need you to do this. I need you to do that. Move his tube out of the way if you can move it out of the way. You're directing them exactly what to do. You're in charge of that room. Don't let them be in charge. Y'all know my stories about nurses, how much I don't like them sometimes. They come in there like they own the place. You're in charge of that x-ray room. You tell them what you need them to do. Don't let them take over that procedure. Leave the patient in the incubator unless they have to be removed. Obviously, that should be common sense. Or until just before the procedure starts, to keep everything as comfortable for that child as possible, to not startle them, to not bring their temperature down. And they do end up very tiny sometimes, guys. I've seen them smaller than this, but they fit in the palm of your hand sometimes. Some of these infants are so premature, their skin's still semi-transparent. Sorry. Goodbye.
Thank you.
They are very fragile, they are very sensitive. Once again, if you can avoid touching them at all, try to do so. But there are cases where you might have to get involved with the positioning aspect of these premature infants. There is a tact to it. You gotta be immensely gentle with these little babies. I mean, if you've never touched a preemie before, I mean, it almost feels like they're just gonna break apart, like break in half. Like they're very fragile, very, very fragile. Hmm? What's that?
Is that a bracelet or
It's a ring.
A ring?
It's someone's ring. It's like a wedding ring or something.
It's so cute.
Isn't that cute? Use a radiolucent cushion, because please don't put them on the table without any kind of padding. That'd be horrible. Discuss patient immobilization plan that will accommodate their condition. Have warming lights available. Wash hands, please. Use gloves and adhere to all isolation precautions. Most of these children are on a very strict isolation regime because, once again, they don't have immune systems. They're too young and they're too premature. We want to make sure we're wearing masks, we're wearing gowns, gloves, that we're all dressed accordingly for these patients. Learn to be and I'm gonna say again, be very careful. Like because most of these are gonna be portable. Some people, they get real gung-ho with these portables. They get real aggressive and very loud. Guys, I mean, I'm telling you, and a lot of people don't believe me when I say this, a loud noise even from your portable machine can startle that kid, that little baby, and they start coding. Like I said, they're very, very sensitive. So you gotta be very quiet. Use comforting words around them as well. You'll hear me talk about that on some of these other age groups. A lot of people get this mindset that a neonatal child or an infant is not mature enough to understand anything. Like, oh, they're just babies, they don't know what's going on. It's been scientifically proven that they do. And they say something as comforting as a soothing voice aids them in healing, aids them in development. So what they teach us to do at TCH when we're working with neonates and NICU babies is just like we'd explain the procedure to a toddler or a young child, we explain the procedure and talk to the baby as well. We do. All right, I'm about to put the cassette under you. I'm about to take a little picture of you here today. And we're talking to them, and that's been proven to be a comfort to infants and aid them in the healing process. It's not weird. And once again, some of these babies, you don't know their situation at home. They may not even have parents. Once again, if you're that one source of love that kid may not get, it makes a difference. It really does. Really, really does. Okay, so neonates, kind of the same thing here, guys. A little bit older than a premature infant. We're still communicating with those caregivers appropriately, let them know what we need, what we're going to do. Also very sensitive to how they're held, rocked, and positioned. Also very sensitive to loud noises. So to increase their security and comfort, maintain that swaddling until you're about to take that x-ray. Most of the time the nurses will unswaddle the baby for you. They usually use the, you ever talk about the mummy wrap or the burrito wrap? That's the mummy wrap or the burrito wrap on the little neonates. Keep them warm. Decrease those noise levels. Don't come in there, I'm gonna do this x-ray right now, you know, like, you're gonna startle that baby, they're gonna code. That can traumatize a young infant. Loud voices, soothing, quiet. There's a reason NICUs are very mellow areas, or they should be. Dim the bright lights. Most NICUs should be relatively dark. We want to keep it as such. Warm room. Warming lights unless contraindicated. Speak soothingly. Once again, that soft voice does make a difference. Involve caregivers to soothe and calm the infant. Also avoid quick movements. These babies, they will be observing you, even though they're itty bitty babies. If their eyes are open, if they see a sudden movement, it can cause the baby to be startled, and all of a sudden their heart rate spikes and they're coding. So smooth, slow, comforting movements. Gently touch the baby, because you do have to touch them sometimes. Pacifiers, this is the magic one right here. Oral sucrose, it's like a little sugar water. They love that. Personal blanket and soft singing may also be used. Now, I don't expect you to go in there singing to them, but you know, if you got a good singing voice, it might work some wonders. But some people, some of the nurses and some of the caregivers may do that for you as well. It really does work. Were you about to ask a question?
Yes, sir. So what do you exactly mean by child will be coding?
By the baby coding, like going into cardiac arrest, like their heart rate spikes.
So when they say code blue, is also like somebody's
It'd be
getting
like
to a
code
heart
blues,
arrest?
yeah.
So that somebody's really getting a heart attack that time? Or
Well, not necessarily a heart attack, just their heart rate and breathing gets too rapid. That can actually kill a baby if it gets too high. Yeah, so you gotta be very careful, very, very careful. Consult with the caregivers to understand what soothing techniques work. Not every technique works with every baby. Separation and stranger anxiety occurs at different ages. You're gonna see that more so with your toddlers and your young children than with infants and neonates. Personal objects can distract and soothe infants. Involve the parents whenever possible. Never, should be common sense, never leave a baby on the table by themselves. Please don't, you know, if you ever do that, I'm gonna haunt your dreams the rest of your life. Let me just tell you right now, if you ever work in pediatrics, you leave a baby on the table, the ghost of Donahue is gonna haunt you forever. Don't do it. Don't do it. Use a ready to loosen table pad and avoid flexing the head forward. In other words, if you're trying to put the cassette under the baby and you flex the head up, you can actually cause them respiratory distress by doing that, compress the trachea. You gotta be very careful. How would you properly put a cassette under an infant? Lift the whole baby.
Unless they're previous,
Now, how,
you just
all right,
put it
I'm
under
gonna
the-
give us a parenting lesson here. This is for X-ray and for parenting. My future parents out there. How do you properly pick up a baby?
With one hand under the head and the other hand.
One hand at the head, one hand on the bottom. And if we're holding them in the arms, head right here, hand on the bottom. Do you ever pick up a baby by like the chest or the abdomen?
Oh,
No, with the
Why
head.
would that? You're reacting, but you'd be surprised how many people don't know this. What's going to happen if I don't support the head?
They might break their neck.
Can these babies support their head? It's a bobblehead.
Christian.
Break
Um,
their neck.
and guess what you inadvertently caused by not properly picking up that child?
The neck.
Like a,
the
uh,
Shaken
cervical-
baby syndrome.
Yeah.
You're gonna. I've seen people pick up babies and like hold them up here, and that baby's head's going. Whoa. I'm like, oh my God, please, like stop, like stop. You could actually cause that child nerve or brain damage by not supporting that head. So always make sure the head is supported. They cannot support that weight by themselves until they are toddler age, typically.
That's how you say it, right?
Okay, so age-specific needs, infant to 6 months, warmth, security, and nourishment are their main needs. They typically do not distinguish among caregivers. I debate that. The science says they don't distinguish among caregivers. I debate that. I think they're able to form bonds sooner than that, personally.
But they forget soon, sir. Because I always had my. When the
I
child
don't
leaves for a
necessarily agree with
while,
that. I don't necessarily agree with that. I think babies form attachments a lot quicker than that, personally. That's my own personal opinion. They are still startled by loud stimuli, and when you learn about child abuse, like we're going to learn a little bit, guys, it doesn't matter if they're a baby or if they're 12 years old. A loud stimuli can be one of the most traumatizing things to a child and cause a lot of developmental issues. They are comforted by pacifiers and familiar objects, obviously. Those pacifiers are great. Usually the pacifiers are the little finger pacifiers at the hospital. You can put your finger in there and they'll suck on it, and usually they'll be nice and calm for you. Put some sucrose on there as well. They love it. Calm, soothing voices are an aid, and always ask for that help as needed. If you're very uncomfortable with a child, get somebody to help you. Don't try to just wing it, so to speak. You might traumatize that child. If they look at you like that, run the other way.
Look at the child.
That means he's about to make a little present in his diaper usually when he does that look. Okay, toddlers. Ooh, we love toddlers, yeah. That's the fun years. I do not miss the toddler years. I am so glad to be out of the diaper stage and toddler stage. I'm sorry for those of you who are still in that, but whew, it's a tough time. That's a tough time. But lots of fun too at the same time. Challenging, needless to say, very challenging as they operate in the here and now. Let me tell you something about toddlers, guys. Toddlers is whenever, I don't know, like they start hulking out on you if they're mad. You laugh, but I'm telling you, them toddlers can hulk out on you when that adrenaline hits. I've seen 2-year-olds need 5 people to hold them down and be like almost lifting people off the table because the adrenaline's going through their veins so intensely. It's just, it's like superhuman strength. They don't know how to control it either. Do not take toddlers for granted. They'll surprise you. Unable to keep still, not because of ADHD, it's just the nature of a toddler. Some do get ADHD, but this is just the toddler stage. Short attention spans, overwhelmed very quickly, and often the most fearful of the age groups. The ones who are going to be what we call the biggest crybabies, but that's the nature of them being a toddler. It's where they are in their development. Okay, guys, and I always say this from personal experience, don't be that kind of tech. Allow the kid to keep their toy or soothing object. Don't take it away and say, I'll give it to you after the x-ray, almost like a threat. Some people got this weird idea, like if I take it away, say, oh, you'll get it back at the end of the exam if you're good. Like that's a good idea. Terrible idea. Allow them to keep that object. That's their soothing object. They need that. Use your distraction techniques and use sincere praise and positive statements. These children right here of this age love to be told they're doing a great job. They love positive reinforcement. Very, very important. Use brief language. Don't use overcomplicated sentences because they're still learning how to talk themselves. Efficiency is crucial. You got to work fast. Even if you connect with that toddler, you got to keep on the move. You can't be sitting there for 10 minutes playing with them because they're not going to stay still for long. They're going to have that short attention span. Praise in the form of positive statements or a small reward. That's the ones that are going to love those stickers the most. But even some of them 10-year-olds love stickers as well. Don't use it as a threat. Use it as a reward. Don't use it as bribery. Just use it purely as a reward. By the way, don't use balloons. I don't know why the curriculum put balloons in there. That's a terrible idea. That balloon pops and they swallow that thing, they're gonna choke on that latex. No.
Or it just pops and scares
But I will
them.
say, my God, I don't know what it's
Kills
about.
their neighbor.
Like I don't know what it is about balloons and kids, but man, I still can't. I did not like balloons that much when I was a kid, but man, my kids are obsessed with balloons.
You mean this? Like
No, just
let it go?
balloons. Not even that. Just balloons. Even my 10-year-old daughter still loves them, huh?
Mine is scared.
The balloons?
I blew up a balloon and I just like threw it up and he was like freaking out.
He's like, never again.
Yeah, no, so his balloons at his party, he was like doing and touching.
Was it the noise?
It
Some
was
children
just
are
the
very-
balloon. I didn't do anything. I blew it up with my mouth because the machine scares them.
Some kids are traumatized by
So
loud noises.
just the balloon just bouncing around or whatever. is
Like
scaring
my
them.
son doesn't like loud noises. Like even when we take him to church, like if he's ever in the main service, we have to give him earplugs because the loud noises like
Freak him out.
he freaks out.
Yeah. The
Yeah.
blender, anything that makes one like that scares me.
I was the same way with a kid though. Loud noises used to like make me feel like I was having anxiety. Like certain kids, they just don't react to it well. Okay, 6 months to 2 years will be the most fearful of pain. They're the ones that have that separation anxiety. Usually the age group you typically want to avoid removing the parents from the room if at all possible. And they're gonna have obviously the most limitations in movement. Some 2-year-olds will be running around, some 2-year-olds are still crawling. It's all different stages of development. They all develop at different rates. Also, as I was saying, they're gonna require the most assertive mobilization techniques. Your book will say use the Picostat. I will tell you Picostats are terrible for toddlers, or really for all babies in general. There is a great way to hold these children down It's not gonna hurt them, it's a lot more effective. Whenever I bring little baby dolls to show the demonstration, I'll show you exactly how to do that if you ever find yourself doing an x-ray on a toddler. And I'm telling you, if you do this correctly, they won't move, they won't be able to move. That Pigastat is, yeah, it's awful. Don't use those. Yeah, and there's the picture of it. The baby torture device. Don't do it.
Where does their leg go?
Huh?
Their legs? Just crisscross?
Just
or-
cut their legs off.
You know those swings that
It's like a little. There's like a little bicycle
like the
seat,
little-
John. There's like a little bicycle seat you can sit
Oh.
on. Yeah, and their legs dangle down below. Those things just don't work. Okay, preschoolers, very fun age. Preschoolers up to kindergarten. They are checking out the world. They're learning new things, new places, new faces, new experiences, which can be overwhelming and frightening. These are the ones that you want to really express. They're going to be your helper. Boy, preschoolers love to be helpers. That's the ones you want to let them touch the tube. Yes, let them touch the tube. Don't be like, don't you touch my tube. That's expensive. Let them, guys, preschoolers like to touch. They like to feel things. They're very kinesthetic. Let them touch the tube. Let them turn the light on. Let them turn the little knobs. They love that stuff. That's them helping you with the procedure. Let them get involved. Let them touch the cassette. Don't let them throw the cassette on the floor. It's a $100,000 cassette if it's digital, but let them check everything out, get that hands-on. It's going to bring them more comfort. Potential obstacles, fear of the unknown, unfamiliar areas. They also tend to suffer from separation anxiety, and they're very much struggling at this stage for independence. Especially if you are my youngest daughter, which I think she's finally getting over that. But they love that independence. Yes, they do. Okay, once again, they're the ones that you can really start connecting as far as learning those cartoons, those movies, those video games, those sports, all those things they're interested in. They're very curious. They love fantasy and games. They cooperate if you treat it like a game, or taking selfies, taking pictures. They respond very well to praise. And if they become out of control, this age has to de-escalate. That's the word, de-escalate. They treat you that in adoption training about de-escalation. If you're not trained in de-escalation techniques, this is where you want to call the CLS service to come assist you, the child services. They're the ones that are experts in that field. Don't try to force a situation. If it's getting out of control, the kid's going nuts, step away, call the CLS over, let them take care of it, and calm that child down before you proceed with the x-rays. Especially, as we'll talk about in a little bit, if they're autistic or if they have other kind of disabilities, Down syndrome, that can be very, very challenging, and you can actually traumatize them further if you try to be assertive and stop that yourself. Preschooler, once again, establish rapport, provide time to familiarize the child with the environment and equipment, let them touch everything, use directive statements, let them know exactly what's going on, what to expect. We're taking pictures of your foot, we're gonna move it around, you're gonna help me out. Assure them you'll let them know what you're gonna do before you do it. Don't just go up there and start moving that leg around. Let them know what's coming up, what's happening, and positive affirmation for cooperation. And you're gonna see that repeated, guys, that positive affirmation. Once again, I always say you never know what a child's environment is like at home. Even if they look to be like a very happy family, you don't know what they're going through at home, and you might be the only positive thing they saw or heard that day. It really makes a difference. We get busy, we get distracted, we get very grumpy ourselves. When it comes to kids, I always try to say, just always keep in mind you might be that one little star of hope that kid ever sees or has seen in a long time. So take that very seriously. That praise, that good feeling that you're giving them. Yes.
So then if the title is highlighted like tips, then you expect you to know all those points.
Oh yeah, that'd be a great multi-answer question.
Nice, because I've seen before, like you have the headings, and do you expect to know us to know everything in that?
Gold star
Just
questions.
keywords I want you all to pay attention to and help you with your studying. Okay, school age 1 to 3, becoming our logical thinkers. They begin to have a fear of failure. Positive affirmation still is going to work great, be very beneficial. Satisfy their natural curiosity by using age-appropriate explanations. Break down the exam into steps. Same thing we already talked about, guys. Let them know what's coming up, what to expect. Let the child know before you do absolutely anything. Avoid that jargon. Really, I mean, that even applies to adults. You usually don't want to use medical jargon around anybody. It's just going to cause more anxiety. be very literal, avoid certain words. And people, I mean, I had to catch myself a lot of times doing this, guys. We don't want to use words like shoot or shot or die. I mean, with obvious reasons. Even if we're using die, which is actually contrast, but some people call it die. Obviously, very negative connotations to those words. And once again, if they're coming from a very traumatic environment, you might trigger something in that child and cause them a lot of extra trauma in life. School-age children benefit from being given realistic choices. It gives them a sense of control and entitlement, and it enhances the coping mechanisms. And for coping and distraction techniques, taking deep breaths, and that's one thing I always love, watching children take the big deep breaths when you tell them. Some of them get so exaggerated. They go like they get a whole full body breath expression thing going on here. You're like, all right, well, take it down a notch, buddy. That's too much, you know. But they get really into it. Blowing bubbles, listening to music, watching a movie, playing on tablets, playing with toys, all stuff you can utilize to help that kid feel more comfortable during that exam. Okay, so for 5-year-olds, their needs are going to start to vary a little more widely. They're usually more confident children. They respond well with a little bit more advanced maturity. Scared children will still cling to that parent and act much younger if they have separation anxiety. Best age, and if you ever start working at TCH, they will typically put you with this age group first. That's the best training age for pediatrics because they're the easiest to work with in general. Easy to communicate with, eager to please, very modest, very cooperative, a lot of fun to work with as well. That 6 to 8 year age range. Okay, adolescence. So adolescence can get very complicated. Now, once again, as I already expressed before, with kids, you always want to have somebody with you, but especially with adolescents, because we're getting into puberty, we're getting into teenage years, we got hormones going crazy, and you don't want to be caught in a situation where someone accuses you of doing something inappropriate with a patient. Now, that can happen with children, that can happen a lot with adolescents as well. You need to always have a witness with you when you're dealing with this age group and be very careful with your wording, the things you say. Ideally, whenever you are questioning a female about her menstrual cycle. If you're asking a 13-year-old about their menstrual cycle, you don't want to be in there by yourself asking that. You want to have someone with you just as a witness in case they say, well, the tech was harassing me about my menstrual cycle and it made me uncomfortable. You need someone to corroborate that story in case they were to say something like that to you. Some of these children have been sexually abused, and it's going to trigger things as well. So you need to always have that witness with you at all times to corroborate your stories and make sure everything is as it should be. Please provide private changing rooms. Do that for kids too, guys. Once again, I would work with techs that would just have them change in the room. That's just stupid. Let them go into at least where I worked, all the rooms have a bathroom attached. So you can have them go to the bathroom and change. Send them to a changing area. Be mindful of that modesty. Don't just have them change and be disrobing in the middle of the room. Very inappropriate. Always knock before entering the room. Limit number of personnel. You need at least 2. Respect gender preferences. You might have a female, 13 years old, that wants only a female tech. That's okay. They have the right to do that. Don't take offense. Go get a female tech. Let them take over. Conversely, you might have a 12-year-old boy who says, I want only a guy tech to do my x-ray. I feel uncomfortable with a girl. Respect that. Don't say, well, I'm the only one here. You're stuck with me. Go find somebody. There'll be somebody else with you, and respect that.
What if I am the
Mm-hmm.
Like, you
They
know,
can-
there's
they
some
can
times
reschedule,
where,
huh?
like,
I'll
like
say-
the guys are occupying the girls.
I'll
are
say in a pediatric facility you won't ever be.
Okay.
You'll always have backup. They always schedule it accordingly. But if you were, I mean, I guess you just have to, as best you can, explain that you're the only person, but they could refuse the exam if they're uncomfortable.
Would they try to see, like reschedule, see when a male tech leave?
They
Working
might,
or
they
something like
might.
that?
I mean, if it's
If
like an
they prefer.
outpatient exam, yeah. Communicate directly with the patient and the parents still, guys. A lot of these teenagers will want to be more assertive and independent in answering the questions. Also, you need to take note that some might be uncomfortable answering truthfully. If there is a pregnant teenager and the parent is in the room, they may not tell the truth. If you have any red flags go off, and a lot of us have a sixth sense, we know if something's up. If you have any reservations or you think that that teenager is acting strangely around the parents, what do you think you would do?
Ask the parent to leave. Or
No,
not
you
ask.
cannot ask the parent to leave.
Ask for
Document.
pregnancy test?
Well, you document, but you would call
See?
call the physician
I see.
and
Oh,
ask
ask
them,
for a
tell them that
pregnancy.
you suspect something's going on. Usually what they'll do is they'll do a pregnancy test or something in private and let them take care of that. That's my point. Let them take
Okay.
care of that at that point. Don't try to force it. Don't say, oh, we're gonna ask your parent to leave and I'll ask you one-on-one. No, that would lead to some, actually that could lead to more issues
Right.
than none. Were you about to ask a question, Jay?
No.
Did I answer your question?
I mean, you got it.
Be sensitive to potentially embarrassing questions. Once again, what do we have to ask our patients to do a lot? Take their clothes off. And just to be transparent, guys, if you have a 13-year-old female patient, don't go in there and say, take your bra off and take your shirt off.
Leave it.
You need to say it appropriately, and you need to have someone with you when you ask them to undress. Conversely, other way around, don't ask a guy just to start stripping, don't use appropriate terms, professional terms, and make sure someone's there to witness what you're saying, because you're getting into an age group that's gonna be more apt to, well, they harassed me, or they looked at me funny, and we're in that day and age where people will sue at the drop of a hat for anything, or they'll accuse at the drop of a hat. So you just wanna be careful, use that professional language, make that a comfortable atmosphere. If you're uncomfortable, switch out with somebody. There's no problem with doing that. Switch out with somebody. Just don't find yourself in a situation that's going to get you in trouble. Ask them if they'd like to have a parent present. They have the right to do so. Validate and reassure their emotional response to the exam. Provide more detailed explanations. Teenagers understand a lot more than little children. Use those same calming techniques, deep breathing, music, conversing with the caregiver, whatever they need to be more comfortable. As far as your preteens and adolescents, they're often very worried about their recovery. They're getting closer to adulthood, so they're going to be understanding things a lot more than a child does. Sensitive issues that may arise due to pregnancy, since menstruation onset varies. If possible, once again, female radiographer should inquire about menstruation with this age group. If you are a guy asking about that, just make sure someone's nearby to witness it as well. Be wary of that modesty, since we do ask patients to undress, and we should do this anyway. Once again, give them 2 gowns to put on. Most gowns kind of expose your backside. Don't leave them exposed to the elements. Give them 2 gowns to be completely modest and cover up all those areas so that they'll be more cooperative and work with you during those exams. And yes.
Sorry, I did have a question.
No, go ahead.
So let's say we do proceed with an exam and they do have, like they are with the child, and we didn't suspect anything. Do immediately call up supervisors and,
You would immediately let the radiologists know.
okay,
And they would take care of it from there. But
okay.
if you're going by what they told you, it's ultimately not going to be your fault, because you document that you still,
They're doing construction.
okay.
Balloons.
You documented that you still questioned, and you had it in the notes that you did, they did tell you no, like, I'm not pregnant, here was my last menstrual cycle.
Mhm.
That's why it's also important to document, guys. Don't ever fail to document, because if you didn't document and it did come back on you, you would get in very big trouble for that.
So if you document and they say, oh, I don't know when my last cycle was, then you would be, then
Then
do
you're
you
gonna,
ask, or
at that
then-
point, you're gonna stop, you're not gonna say, I'm gonna give you a pregnancy test, bad wording. You're gonna go tell the radiologist and see what they want to do.
Okay.
Usually they'll take care of it from that point.
Okay.
Usually they'll come talk to them themselves, by the way, the radiologist.
Good to know.
Special needs. Special needs patients can be extraordinarily challenging, guys. Autistic children, Down syndrome children, learning disabilities, ADHD, very challenging. We have to adjust accordingly to meet these children's needs and get our information from the parents or the caregiver of what is going to work best for that child. So consider age and behavior when approaching children with physical and mental disabilities. Since of the fact that they are going to be less independent than their peers, use these guidelines. So introduce yourself, identify the patient at their level. So you might have a 15-year-old who is at the level of a 3-year-old because of a disability. You want to once again gauge that situation, use appropriate language, talk to the caregiver, find out what's going on to give that appropriate care. Briefly explain the procedure to child parents. If ineffective, turn to the parents. Younger children may only trust one person, their parent. Gain cooperation by communicating through the parents. The parents are going to know the needs of these children the best. A lot of them are bedridden. A lot of them are, some of them are in vegetative states even. We've had special needs that are in vegetative states. Get that parent involved in this procedure. It's gonna be vital. Get that caregiver involved. They'll have like their own personal nurses that take care of them as well. They're gonna be vital to not only helping you with that procedure, but holding them still, getting them in those positions, making sure we don't hurt that child, so on and so forth. Ask the parent or caregiver if there's anything you should know about to achieve a quick and accurate exam. Autism spectrum disorder. So ASDs, this can be a very challenging group of children right here that can get very out of control very quickly. Not their fault. They can't help it. It's a disability, but it can escalate out of control very, very quickly. So group of developmental disabilities that can cause significant social, communication, and behavioral challenges. They handle information extremely different. And autism has quite the spectrum. If you've never studied autism, you have very mild, you have very severe. You have autism, you have Asperger's, you have different levels. A lot of people just see the stereotype autism as a child going nuts, out of control. You have the other spectrum where a child can be overly calm and have Asperger's syndrome and be very overly awkward with social interactions, so to speak. There's all kinds of spectrums within the autism scale. It's a whole other class into itself. But be aware, we can't typecast them all as one type. There's a lot of different types of autism out there, and all of them have their own ways that we handle them accordingly. Actually, autism has been shown to be on the rise, and we're seeing more of it these days than we ever have before. 1 in 54 children in the United States by itself are diagnosed with autism by the age of 8. That's a higher statistic than we've ever seen before. A lot of controversial theories on that. You have people that are anti-vaxxers that believe that's what causes more autism. I don't know if they ever scientifically proved that or not, but you got all these theories going around about what's causing the advancement of autism. But we are seeing more of it through the years, more children being diagnosed than ever before.
Mr. Thomas,
Yes,
is autism a genetic disease?
it is in genetics, yes. Yes.
So the child is born with a deficiency.
Usually you don't notice until they're a little more,
They're older.
2 to 3 is usually when they see the earliest signs, but you're not gonna notice like an infant that they have autism.
With the behavior basically.
Yeah, because they start seeing how the cognitive area is developing, and a lot of times they'll be severely delayed. And when you have a child that's delayed cognitively, they'll start testing for autism at that point. But it varies per patient. Yes,
I've read that they can do genetic testing to find
they
out
can.
whether.
They can. We did that for Ariel, matter of fact, to see if she was at risk, and she was not. They also link a lot of the autism to drugs, like if a parent was a drug user. So that's something we were worried about with our 2 adopted kids, because both my children were children of meth addicts. But luckily, both came negative on them as well. But that's one of those theories, like the anti-vax theory as well. They don't have 100% proof on that, but they tend to try to link it with drug addicts as well. Are we out of time?
Oh,
Yeah, it's 3.
Oh, it is 3. Huh? Okay. All right, guys.
What?
Y'all be safe. Be careful. It's nasty out there. We'll see you in the morning.
Can y'all
Take
unplug
care.
the lights, please?